yeah. Can't hold my pain. Where can I hold my hand? So stranded and lost. The dark hours I can't.
My name is Ambrose Ongom. I am a nurse by profession, an enrolled certificate nurse by qualification. I actually trained from Arua School of Comprehensive Nursing and Midwifery, and currently working with TICK Bedside Nursing and Elderly Home, Kampala, Uganda.
I am Kevin Desire, a qualified registered nurse working with TICK Bedside Nursing. I trained from Zambia Hospital Training School, and I have worked with TICK for 2 years now.
Well, I would have so many things to talk about as far as working with TICK is concerned. Looking back right from the time I joined TICK up to this point in time that we are still moving on. When I joined TICK, everything was amazing, and I was welcomed, of course. I was actually welcomed by loving people, caring people, and everything is still moving on well. And that definitely made my work right from the time I joined up to this particular time that we are moving on. Everything is still moving in a perfect way. When I talk about the experience that I've had with TICK, I have a lot of things to talk about. TICK has made me learn both the negative experience and the positive experience. But I would actually love to talk about, the positive experience that I've gained while working with TICK. One of the experiences that I've had, and of course those are the benefits, I see myself along the journey that I've been taking. I've met very many important people in life that I never knew I could meet, and that really tried building me as a person, upgrading my life from the person I was to the person I am today.
With the 2 years, I've got the experience because I've worked on a number of patients. We talk about the elderly, the postnatal mothers, and other patients with different conditions. Talk of stroke, heart diseases. So with that long, I have really developed passion for the company and its services.
Secondly, working with TICK has made me to be a self-reliant person. As a nurse, from the time I got out of school, I got a job with TICK, working with TICK up to this point. I have been earning a living on my own. And upon earning a living on my own, I don't depend on my parents, my relatives, people around me, the friends. I am on my own as Ambrose.
We get to interact with a lot of people. Talk about interacting with our fellow nurses, because TICK Bedside Nursing has a lot of nurses. Interacting with our patients and their families, and we get to meet a lot of important people. We are paid a stable salary, and with this we get to earn a living. Yeah.
TICK has taught me one basic thing, in a sense that I've learned a lot about how to handle people's emotions. because at times when a client takes you and you're there working with the client at home, his or her home, there is a tendency that you get to learn how to handle the client in his or her way. And apart from that, TICK has made me to be someone who has developed. I mean, when I get my pay, I look at what I can invest in and see that my life is moving on. I'm able to help people around me and many more.
With TICK Bedside Nursing, we learn to be versatile, flexible. We are able to adjust to every situation. As a nurse, I have worked on patients, a number of patients, as I said, and I have been appreciated. Yeah, and that is a very big benefit. That is a motivation that keeps us moving, being appreciated when the patients heal or improve.
The caregiver, the struggle for your life. The caregiver.
Well, in life, it's all about advantages and disadvantages or challenges and the good part of life.
We have our challenges, both the side of the patient and the side of the nurse.
With TICK, I can say I've encountered some of the challenges, and the challenges I've been facing, they are common challenges that anybody else would face.
Okay, here we have our entitled patients. Here there are those clients, entitled family members or entitled patients that when you don't reach their expectations, they will be harsh to you. So that leaves us to live in a harsh environment in fear. You're doing things in fear so that you reach their expectations.
If I'm to remember one of the challenges that I've been facing, and I always see they happen, it is that working as a bedside nurse is a work that you are being underlooked at. You find you go to a client and there is a way they look at you like you're not a professional, and that really worries. To me as a professional, I see it's not the best way of treating us as the bedside nurses.
We have a rejection challenge. Rejection challenge wouldn't be much of a challenge to TICK Bedside Nursing because we are well trained, but it comes in occasions of language barrier, and which is understandable because when the elders advance in age, they get to forget the little English they know, so they resort to only using the mother language. So getting nurses who strictly speak the same languages of the clients is a little hard.
Another challenge is that we are being disrespected. Someone shouts at you, they bark at you, they yells at you. All those kinds of abnormal shoutings. And that's not good because a professional has to be treated as a professional. To me, that's what I know.
Abuse of responsibilities. You are a qualified nurse, you have gone to work, you are at a client's home, and instead of only doing what your qualification is, you are doing the nursing work and also in the kitchen cooking for the family. That is.
So to me, that I see it as a challenge because this is someone giving you the best of him or the best of her. So I see it's better you respect one another, and that really makes work so good. Another thing I see is that working as a bedside nurse, gives you limited time to do your personal things, because each and every time you are confined and fixed in one place.
Being constrained to one patient. Being a full-time nurse, you are constrained to only one patient, so you get to do the same routines every day. So you know, when you wake up doing the same thing every day, doing the same, waking up, bathing patient, giving them breakfast, then doing this and doing that, you are one person, you are doing everything, and you develop lack of interest. Yeah, you develop lack of interest, and there is also all that when you're only one, it becomes hectic. So it taxes your body and leaves you when what? The word is lost.
Bedside nursing as a career is one work that really keeps one confined and fixed, in a sense that once you are engaged, there is nothing like running your personal activities. You're always fixed in one place, right from the time you have gone to a client, from day one till the last day. So you find yourself being cut from so many things that you have to do as a person. Another thing I see is that some of us bedside nurses are being rejected. You are being taken to a client, and a client says, "No, I don't need that." Yes, based on their preferences, you hear someone saying, "I don't need you, I need the other one." So we cannot also, stop them from their choices. They have to make their choices. It is their right.
Doing a lot with less equipment. Sometimes clients don't provide sundries. And these are the things that we need. These are the things that are so essential for a patient and you, the nurse. For example, protective gears.
Another challenge that I see with bedside nurse is that sometimes you go to a home whereby you are given extra jobs. You have gone to give treatment. Someone is again telling you, "Go and open for me the gate, go and cook for me, go and do for me this." The last that I would want to talk about is that doing bedside nursing is a kind of work that is a bit tiresome, because at one point you realize what you have done or what you do on a daily basis is much more than what you are supposed to do. In other words, it's a bit hectic.
TICK Bedside Giver. Our priority is your health.
Well, so many pieces of advice I would give to the fellow Ugandans about embracing the bedside nursing, because to me, as a professional nurse, I see bedside nursing as one of the space whereby one can easily and simply get medical services within his or her reach in a short period of time, compared to someone still running to the hospital, but this one is fast and a bit quick.
To all the Ugandans out there, aging is a natural process that happens to every human. So it is a good gesture for us to embrace, to come up and take action and care for our elderly people. These are our parents.
Our priority is your health, the caregiver.
To TICK Bedside Nursing, I would only say, let us render quality services to the people of Uganda and people outside Uganda, because I see there are some of our nurses who always even work beyond Uganda. So it is better for TICK Bedside Nursing to give quality services to the people, and we ensure that we save lives of our fellow Ugandans and other people around the world.
For TICK Bedside Nursing Care, we appreciate the good works, the services. At TICK Bedside Nursing, we actually took caring, we do personal, we do caring services. And if you have your elderly mother or grandfather, it will be a very good gesture to call potential service providers to take over, to care for your patient, to care for your elderly. It will keep you blessed and keep you happy.
Yeah. Can't hold my pain. Where can I hold?
I'm Goreti Bamnganga, Mrs. Bamnganga. I'm married to one man who is Stephen Bamnganga. He's actually inside. I'm a mother of 5 and I'm a grandmother of 9 now. I love family and I enjoy family. TICK services. I got in touch with them during the time my mom was sick. That is in 2021, and she actually was not sick. All of a sudden, one night, one day, she refused to stand, she refused to eat. I was so desperate for the first 2 days. So immediately that day, I was in the house with a mentee talking to her. And he told me Mama has refused to eat, has refused to stand, to go to bed. And that young lady told me that, I know a service provider who can do bed care. And she mentioned TICK services. And she even gave me the contact number of Madame Margaret. I called her in hours. Then we got that one of the best nurses. The girl's name was Bernadette. After that, Bernadette did a very, very good job. I can assure you what I found with the TICK is one, communication skill. Communicating to the patient so well, communicating to the people taking care so well. Then the general management, like bathing her in bed, turning her, feeding her without using tubes because she had refused them. But that girl knew how to talk to her, how to bake her, and she would eventually sip a little juice of apple and carrot. I would, and I have. I have done that. That young girl, Bernadette, even came to bury our mom. At the funeral service, TICK services was present. On the funeral here at home, the video, Madame, the director herself, came in. And those days were bad days of COVID. So when I saw her, I said, my Jesus, this lady has even dared to come to be with us on this day. Well, anyway, they did a great service for us. They gave us emotional support that we would not have got from anywhere other than professional care. So I would recommend that if you have to go for bedside care, go to TICK, because that one I know it for a fact. Bedside services is so strange to Ugandans. Let Ugandans know about what it is. But I will also tell you that it's difficult to know something until you have tasted it. until I got face to face with its need. Even me myself, I didn't know how so important it was. You see, you love your person. You decide even to put funds on the side to look after that person. But the real management, besides even medical, just the management of a person who can't move, is so professional that those who do it just like that, they even hurt their patients in the way they lift. You imagine going to bathe a patient who can't walk and you are not professional. They struggle. So I would recommend bedside nursing to anybody. And for me, immediately after that, I talked to my people. I'm even going to save my own money so that if I'm lucky and I live as long as my mom lives, and that time comes, I must be able to be in charge of the finances. Yeah. Well, it would be for a certain class of people in very many ways. One, you must have space. You see, if you don't have space for a caretaker, but it is a service for serious people. Yeah. So even if there is no space, a serious person will improvise. I've always thought and wanted the government to bring it in as a policy, because that's how you will cater for those who think they can't afford. But that would mean the government would even get homes. So if my parents need care and I have no room, they take them to their space, because like the developed countries put up apartments for them. Actually, you find an old person in one roomed house which has a kitchen and a bathroom, and the caretaker comes and takes care. To be frank with you, everything went smoothly the minute I got Margaret's number. I don't know whether you are the pioneers in Uganda, but to me, you did a great thing. I was at peace during a difficult time, during a rough time, and that peace was provided by your care. The nursing care that girl gave us was top notch.
Orije mama. Hatka tushtamani unkwishongora. Kunabire mbuzire bansherura wambona banyozyane mbabazi narera toka kama nyakoshi burijo kandi tuyishongora hamwe so toka mizire mbazi wawa mizire uko tuizo nyo
How can I explain the caregiver, the struggle for your life, the caregiver.
otyo tuizo no twetaga hata kwishongora ekishongora Nembabazi, eshongora na nembabazi, nembabazi, ruhanga wita nembaba, numwesigwa. Ma, Yesu numuza kubaji. Yeah. Nas desire. Yeah. How is mommy?
She's fine.
Hey.
No complaints.
She slept well last night.
She slept well.
Yes.
In the morning we gave her breakfast.
Oh, she ate, eh? By the way, the other day I saw she was, at least nowadays she eats. She doesn't take 3 hours as such. When I come in the evening, I usually find her when she has already finished
She
eating.
has a speed.
Oh.
She has improved.
I think see she looks nice. Mama no rebe kaje hasa. No rebe kaje. Abo kurya wanywa. Nozo kubaje ubuzima gero kusije. Wewe bari kumurebera. We are so grateful bajenzi.
Me to hide this pain. I cannot just do it anymore. No. I need the money, but I have to face the chain. Untamizo kwagaya. Please, love, don't turn your back.
Yeah, well, my name is Margaret Basheja Businje. I'm 54 years of age and legally married. I'm a mother of 6 children and also a grandmother to 4 children. I hold master's degree in management studies from Uganda Management Institute. I also have a postgraduate diploma in public administration and management, also from Uganda Management Institute, and a bachelor's degree in secretarial studies from Makerere University, and a number of other short courses in customer care, public relations, name them. So I'm currently the executive director of TICK Bedside Nursing Care Uganda, and also we have extended it now, we call it TICK Bedside Nursing Care Uganda and Elderly Home. TICK Bedside Nursing Care Uganda was registered, I remember, on 22nd of April 2016, and it's a legally registered bedside nursing company. Yeah, so we started operations around May 2016 when we hosted our first nurse out there. And we have been there serving since then as bedside nursing company. We're one of the pioneer bedside nursing companies in Uganda, and I'm glad to have been, part of reaching out to take care of people's lives. TICK Bedside Nursing Care Uganda basically started in 2015. I remember when I I started, you know, thinking about the services is after I had nursed my mother, my biological mom, for quite a long time. And my mother is still actually alive, but she has been in intensive care 3 times so far. But it's the last time she was in intensive care around 2015 that I had the tension, that I went through a lot of challenges. I work with Bank of Uganda even today, and I was then working with Bank of Uganda, and my mom was down for a long time. I just saw my job was going to be wasted, and I would be asking for excuses. My mother is sick, so I hired services of a bedside nurse. And from there, I started seeing the importance, because the stress then started reducing. The person who started calling home 3 times, 4 times a day, now I could no longer call, because I would come in the evening, my mom is happy, she's very clean, she has taken her medication on time, she's just there, although weak, but thanking God and, you know, blessing me for having taken good care of her. So it is then that I started praying about it as a Christian, and until 2016, when I came across a friend who was a professional nurse in Mulago. Her name is Annette Virungi then, and we put our minds together and then thought of registering the company. We brought on board the consultants, they advised us on what to do, how to get licenses and all that. And when we were done, then now we advertised for the nurses to come on board. We had to bring whatever necessary material was available to be able to serve, and that's when I can say we started. And as a result of nursing my dear one, I saw the usefulness of you know, of a bedside nurse, and wanted to extend the same services to other people as a way of giving back to God.
Yes.
Yeah, as a way of giving back to God, really, because I thought I would also serve. Our vision is to be a leading bedside nursing company in Uganda and beyond. And actually, our mission is to offer
Yes.
specialized and high quality professional bedside nursing care to individuals and families that need these services, both in their homes and in hospitals, in a more professional manner, with dignity and flexibility at all times. I chose to do this kind of service having seen that it is a very, very, very good service, especially to the working people. Because remember, I was working,
Yes.
and I saw I could have been inefficient at my job. But you know, there are a lot of people who are working, yet they have their loved ones sick back home. And it can affect your performance at work, actually. So when I saw what happened with experience, then I said, yes, this must be appreciated even by other citizens of this nation and even other people. So it encouraged me to start. And secondly, as a person who is educated in areas of management with a master's, I have public administration, I have customer care, I have all these skills. I was confident, sure, that I would be the right person to do this service. And secondly, touching lives. As a Christian, it is the job that gives me joy. It gives me joy to serve, to help some needy people, weak, vulnerable, and then you see them coming up and recovering and becoming well. It's amazing. That's why I had to start it. And I can assure you, at TICK Bedside Nursing Services, then we ensure that we get very well trained nurses that are enrolled and registered. They have practicing licenses. ready to work. We have diploma nurses, we have psychiatric nurses, we have midwives, we have even bachelor's nurses. So we bring them on board to ensure that people receive quality and befitting care. Oh yes, I am sure that people appreciate bedside nursing services, because this one you see it from, the feedback that you get from people. You care for people and then you see them really appreciating, you have really helped us, your nurse has really done very well, oh my God, we don't know, you really, So from the appreciation, how people appreciate our services, the feedback they give us, and the referrals they even give to their family, friends, to their relatives to come and contact us, we have been able to expand because of people's support and because of our services. Not that we don't meet challenges along the way, but I am sure that they have appreciated us. Even when challenges come in, then we look for how to address them. We've been able to address them. And I have also seen ourselves grow. Yeah, we started with 2-3 patients, but now we have made 15, 20, 25, back to 18, 30 sometimes. So you really see that, if it was not a necessary service, then they wouldn't come. And I'm glad that people really appreciate the services. Services of bedside nursing company really, as TICK Bedside Nursing Care, I think we have really been we have contributed to the government by employing the nurses that are trained in this nation. In a way, we are also, easing the pressure of the government on unemployment. Unemployment in Uganda. So I'm glad that I have been able to employ over 800 nurses from 2016 to date. Reason being, 800 may sound, there are many nurses come in, and then those who get opportunities to join government institutions, they leave us, and so we continue to recruit. We have also cared for the citizens of this nation who have really attained good health. We have provided quality healthcare services to citizens and in a way added to their lifespan. Because you may ask me, I'm not a doctor, I'm not a doctor, but I've seen it from my mother, like I told you. She has been bedridden. She has gotten stroke along the way. She's a heart patient since 2011. She's still alive. She's still looking healthy, though weak due to age. She's now 81. But to me, I think she has been able to live long because of good care. God also being the giver of life. Yeah, it is by God's grace, but again, good care really has helped her. And also from experience, the elderly that we care for, they recover faster. Yeah, they recover faster. Others may die. Yes, death is inevitable, but a number of people have seen them recover faster because of good care. So I feel we as TICK Bedside Nursing Care and Elderly Home, we feel very privileged to see that we have been, helpful and useful to the nation by also touching lives. The nurses are able to earn a living from the income that we earn from the clients. We have also reduced on stress of the citizens of Uganda. Those who are able to afford our services, they are able to go on and work and become useful citizens as we are back home, caring for for their patients in a professional manner. Yeah, as TICK Bedside Nursing Care, I think we have also benefited in a way, because we are connected to important people of this nation. I may not have to mention them by name because that's a private, it's a private care that we give. But you find very many important people, you are exposed to many people, you are seeing your nurses, grow and become mature and useful citizens. Our nurses, some of them get married and give, it's quite a lot. And also, when we look at where we started from, we started in a small office in Tinda Chigo at that time, I remember. We were separating from someone, but currently we now have a home of the elderly, fully furnished, good facility, because of the passion that we have put in to do the job, and by the blessing of God, we have seen ourselves grow. The other benefit to me, I think, because of remunerating, we try to remunerate our nurses very well. We try to work transparently as Christians, as true people and a credible company. So when you pay these nurses well, then they have themselves gone and brought in other good and really good quality nurses. Well trained, well specialized, they come to us. So we have not run short of the nurses. To me, that is a great achievement. Our services cut across. Remember, we are a bedside nursing company. Remember, we have a variety and a wide network of nurses trained in different fields. So we do physiotherapy services. We are connected to very good physiotherapists in hospitals. We have been able to connect with hospitals and then capture that team. So we make sure that whoever among our elders we are caring for, or whoever contacts us and they want physiotherapy services, we connect them. Along the way, we also have a home of the elderly, and we do accommodate elders. We also give weekend, package to the elders who need to change the environment. So we've seen them come and we have accommodated them successfully. Above all, we do guidance and counseling through our professional counselors who go and talk to the patients, encourage them to ensure that they are in the better state of mind and they are able to relax. I know healing starts with the mind, and then get to recover and get well. We also care for mothers who've just given birth, and we have a good team of professional midwives who go and find the mothers at the time of admission. We do massage services because at a time when we don't have the elders coming to enjoy our facility, then we have the masseuse, very professional, who come, and people come of all types. You can come at any time and then you enjoy the massage in a quiet environment with us. We care for all sorts of patients, by the way. We've seen parents contact us to care for their autistic children in homes. Yeah, we encourage them to develop their sense of mind and to be able to, in the long run, care for themselves. We have some of our good clients that we do vital observations on daily as a service to continue observing on their progress, especially the diabetic and hypertensive people. We try to manage them, to manage their nutrition, to ensure they are in good condition, and we encourage them to live a healthy life, to eat healthy. We wash for the patients. Our nurses go extra mile because we take full care, ensuring their hygiene. They wash for them, they make their beds. They clean their rooms, their bathroom, to ensure the patient is well cared for in a very, is in a good condition. And next 5 years, because we have seen people approach us, they want to bring very sick people at our accommodation. Our home of the elderly is in a facility of apartments where we have other residents. So we have not been able to accommodate them. When we accommodate the weak who have come to rest and maybe recover, but in 5 years we hope to have acquired a house of our own, residential house which is independent, so that we can set up an actual bedside or nursing home. From a home of the elderly, we intend to make a nursing home. A nursing home will be more of the hospital. In 5 years, I believe we shall have brought on board 2 residential doctors to check on our patients. I see ourselves setting up laboratories and lab technicians to check our patients. I see ourselves having a pharmacy around the facility so that when doctors prescribe, the medicine is right there in 5 years. I also think we should have extended the facility to have a cold room just in case someone passes on. As you know, death is inevitable. Someone can pass on. We have a cold room where we can put, the body for a short time before they take to bigger places like a mortuary. Definitely, it's our dream that we have like 2 ambulances on board, and then these ambulances will be able to bring our patients when we are called upon to pick them, and also for the hard cases that become and need specialized services in a referral hospital like Mulago. We have a standby ambulance, and they can be ferried quickly to be given special attention when time comes. But we also hope to acquire funding from a credible organization, like you said, maybe from government of Uganda through Ministry of Health, after they have appreciated our services. We are doing all we can. So when we get the funding, then we shall be able to reach out to the people who even call us, because we've seen a number of patients calling us. They really love our care, they need it, but they cannot afford. TICK Bedside Nursing Care, our motto is that the patient's health is our priority.
Okay.
And for us, that's what we stand for. We want to ensure that our patients get quality and specialized nursing care. We want to be able to pay attention to them. The patient's health is our priority. We want to ensure they are in good condition and well. Challenges are enormous. There are many. One big challenge is some clients are really not trustworthy. People do terminate contracts abruptly, abrupt termination of contracts. The other now challenge we have is nurses now, they first ask what's the condition of the patient I'm going to care for. No, if it is lifting, no. If they are so bedridden, so you find we are taking time to make sure we get only the committed people who are not going to complain, and also to counsel the relatives of the patient that please, when it comes to the time of lifting, give a helping hand and turn this patient. Don't strain the patient and don't strain the nurses. Now, when it comes to nurses, we also find challenges. These nurses go through difficult conditions to be able to serve. Yeah, they have sleepless nights. Yeah, they don't get enough rest. Others are not given meals. They are not given what to eat. They are starving. They call you, we are working, but we don't get breakfast. Director, we we are not, the clients are handling us like maids. For our female nurses, they tell you to peel matoke, to start cooking, all the meals for the family, do all the chores, then we take, it's a struggle. You find us counseling these families, we say, look, and this is a professional nurse, they are trained to care for your patient, please don't engage them in cooking. Let's have another worker who can do cooking as the nurse pays attention to the patient. The other thing is, I have seen nurses approach me with problems. We give them advances, because remember they are on duty. And before you notice, the patient maybe passes on and they are taken advances. So what do you do? Recovering money from such a nurse is not easy. So we've made some losses in the long run. So the other one is in the middle of work and the nurse tells you to increase the salary. You see, work is too much. We need more pay. You've already signed a contract with this client and the nurse needs an increment. Where do you get this money? The rejection of the patients, a family member calls you, I have my elderly dad, my elderly mom, please come and provide care to them. And these relatives reject the nurse. They've rejected us over time. They think that the family is no longer interested in them. That's why they are hiring a professional nurse. But no, that's not the case. So sometimes we try to first, cancel them, and the others have accepted, others have totally not accepted. And so we have lost those jobs. Our nurses being sexually abused. I haven't said, a nurse comes and tells you, look, I have this person who is now extending other things to me, but I don't want, I'm there to work, and they are doing that. We have nurses who are gone to care for patients and they are telling them to care for the dogs as well. I mean, things don't connect. So we are always, trying to counsel, talk to the families, talk to the nurses. Some nurses have not met the standards also. So we have seen ourselves trying to train these nurses. You bring the consultant on board to come and train. But after training them, the nurses go. They want to leave for greener pastures. So nurses keep leaving. You call somebody who've just trained to go and work, they tell you they are not available, they've been taken, they've got jobs in hospitals. So we have had a continuous recruitment of the nurses. Of course, the biggest challenge is when we have a good nurse. Our good nurses keep leaving us. My final remarks to the Ugandans and to the citizens of this nation. Dear citizens, dear viewers, I think all of us deserve to be cared for when we get sick and get very good care, and support when you are weak. So, and there is no any way you can do this apart from hiring a professional nurse. Bedside nursing services, we are not very expensive. Please reach out to us. We can advise you on how to care for your patient at a very minimal cost. And also, to those ones that have retired, we have people, you retire from a very big position, you have all the resources you have accumulated, but then you suffer when you get sick. Please, don't suffer. Use your small resources to get professional care without any complaining, because we are professionals. We shall reach out to you. And also, the nurses out there, please, don't spend time, jobless. Let's go low and help the people privately in their homes as we wait for other big jobs in hospitals. Once again, I'm very happy, I'm very glad to have gotten this opportunity to talk to all of you there. Yes, may God bless you and cheers.
This life and